Hi there, parents, caregivers, legal guardians. My name is Gabrielle Maggie, and my partner is Xavier Rodriguez, and we are here to present to you eosinophilic esophagitis. So, some background information on my partner and myself. I have a bachelor's degree from Johnson and Wales University in culinary nutrition. I received my master's degree from Texas State University, and I'm currently a dietetic internship through Texas State University.
Hi, everyone. My name is Xavier, and I have a bachelor's degree from Texas State University in nutrition and foods and with a dietetics concentration. I'm currently at Texas State University in the grad school program getting my master's degree in human nutrition, and I'm also a dietetic intern at Texas State University.
In this presentation, we will discuss eosinophilic esophagitis, EOE for short, discuss treatment for EOE, discuss various diets to help manage EOE, and provide you with helpful resources. So what is eosinophilic esophagitis? Well, it's a chronic inflammatory disorder of the esophagus that is triggered by a food antigen. Large numbers of eosinophils, which are white blood cells, and more specifically disease-fighting white blood cells, are found in the inner lining of the esophagus. Eosinophils can cause inflammation. Normally, there are no eosinophils in your esophagus. However, if there are, a person will have inflammation and increased numbers of eosinophils in the esophagus. Signs and symptoms vary throughout the stages of life. EOE is not outgrown. So for infants, they will refuse to eat and they will have slowed growth. School-aged children will have decreased appetites, reoccurring abdominal pain or heartburn. They have trouble swallowing and vomiting and difficulty swallowing due to inflammation. Food can get stuck in their esophagus, which is also known as food impaction. Teenagers and adults have the same symptoms as school-aged children. Dysphagia will occur, which is difficulty swallowing, and their difficulty swallowing is due to dry or dense solid foods, which then results in food impaction. The relationship between food allergy and EOE is complex. And normal IgE-mediated food allergy triggers are easily diagnosed because of quick onset of reactions, such as a rash, hives, closing of the throat, basically go into anaphylactic shock. However, in EOE, reactions are delayed. They can develop over days, so it's hard to pinpoint which food is a trigger. But the most common triggers are cow's milk, egg, soy, and wheat. For testing, conventional allergy tests are not reliable because they fail to detect sensitivity to the foods causing EOE, such as the prick skin test, blood test, and food patch. Persons with EOE may have more than one foods triggering their EOE as well. The best way to test is elimination diet, having a food diary to record which foods cause a reaction or not. Removal of suspected foods from the diet, followed by a decrease in symptoms and esophageal inflammation, is necessary to prove that the foods are causing EOE. An allergist will also test for environmental allergies such as pollens, animals, dust mites, and molds. These also play a role in EOE. For treatment, Xavier will go more in depth, but for right now, we have food test directed elimination diet, empiric elimination diet, elemental diet, medical therapy, working with healthcare professionals, and support groups are all in the scope of treatment for this disease.
So first, we're going to discuss the food test-directed diet. So after a skin prick test for the sensitivity to a food, the doctor will remove that specific food from your diet to monitor EOE symptoms. So this is case dependent, so it's not for everyone, but this does help to control EOE symptoms. Next, we do have empiric elimination diet. So this starts off by eliminating the 8 most common food allergies from the diet. So these are listed here. So that includes dairy, egg, wheat, soy, peanuts, tree nuts, fish, and shellfish. So this is very helpful in treating EOE, but it is very hard to follow. Now, these foods can be added back one at a time with follow-up endoscopies just to help to determine which food is causing the EOE. And lastly, we have the elemental diet. So this is a strict elimination of all the diets we just discussed in the previous slide. And all sources of allergens are removed from the diet as well. So patients receive nutrition from amino acid formula alone, or sometimes while allowing 1 to 2 simple foods chosen based on their low likelihood to trigger EOE. So amino acid formula, what that is an amino acid is just the simplest form of a protein. These are kind of like the building blocks for the protein. Now, in the very severe cases, a feeding tube may be needed in very young children. And this type of diet is reserved for children with multiple food allergies who have not responded well to any other treatment. So I wanted to discuss some alternative ingredients for EOE elimination diets. So one of the big ones is going to be milk alternatives. So alternatives to cow's milk include almond milk, cashew milk. They could also be coconut, flaxseed, hemp, oat, pea, and rice milks. And it is recommended to choose these alternatives that show original or unflavored, because these options have a lower sugar or no sugar at all. And yeah, you don't want to have that excessive sugar. We also have wheat alternatives. So wheat is the most common source of carbohydrates in most kid-friendly foods. So this is going to be in bread, pizza, and pastas. And when looking at a nutrition facts label, you can look for the alternatives that show rice, oats, corn, and quinoa. Next, we're going to discuss medical therapy. So currently there are no medications approved by the FDA to treat EOE. But eosinophils can be reduced in the esophagus by certain medications, and they also lower symptoms. So the first one we're going to discuss is corticosteroids. So this is the most common treatment, and this helps to control inflammation. And swallowing small doses of corticosteroids can treat the inner lining of the esophagus. Next, we're going to talk about proton pump inhibitors. So these reduce acid production in the stomach, and these have also shown to reduce inflammation in the esophagus in patients with EOE. However, this is not the most common treatment, and it's not for everyone. And of course, there is a lot of research happening right now on EOE, but we do need more research and treatments to see what can treat EOE. Next, we want to discuss working with health professionals. So this is going to be, it's pretty much teamwork. So first, you will see the gastroenterologist, and they will discuss how to manage EOE, and they also do endoscopies to see the inner lining of the esophagus to see how severe it is. From here, they will direct you to the allergist or the immunologist, and they check to see what allergies are playing a role, and they also help to manage related allergies. And lastly, probably one of the most important roles is going to be the dietitian. So they can help with specific diets, for example, the elimination diet, and they can work with you to see if they can add on certain food groups, and they can help to see the severity of how EOE is. And then we wanted to discuss with you guys some support groups and resources. So we listed them here. So a really good resource is going to be the American Academy of Allergy and Asthma. We provided the link for you there. If you go there, it has pretty much the rundown of everything EOE is, from the treatment, diagnosis, all that. And then we wanted to provide you guys with support groups here in Texas. So we provided the websites and the Facebook groups to a group in Austin and another group in Dallas, Fort Worth, Texas. And here we have other resources. So the top one that's called Nutrition Neocate, it's a pretty helpful resource, especially if you have an infant that has EOE, because it gives you different formulas that you can use for them. That way they don't have any signs and symptoms. And then the very last link is going to be the EOE diet for kids. So that is also a really helpful link. If you click on that, it goes everything with you from reading nutrition facts labels to alternatives, like we mentioned earlier, milk alternatives, wheat alternatives, all that stuff. And if you need help finding an allergist or immunologist near you, we also provided that link here for the American Academy of Allergy and Asthma. So just to summarize everything that we went over today, first things first, EOE is a chronic allergic immune condition of the esophagus. Common food triggers include dairy products, eggs, soy, and wheat. Signs and symptoms, we mentioned that it's you have trouble swallowing, there's decreased appetite, there's vomiting and food impaction. And then going over treatment again, so elimination diet is one of the most common ones. Corticosteroids help manage EOE, and proton pump inhibitors also help manage, but it's not for everyone. Lastly, you want to communicate with all specialists, so gastroenterologists, the allergists, dietitians, just to see what the best plan of action is. And remember, you're not alone. So we recommend reaching out to support groups or looking up those resources that we provided for you. And thank you guys. If you have any questions, feel free to ask your questions.